Kids, listen to your mother.
Mom!
Welcome to Between Us Moms with Katie Crafts-Morg and Hallie Stevens-Drake. All right, mamas, today we're talking about something most of us deal with, but almost none of us were taught about our pelvic floor. Leaking, pressure, painful sex, feeling not quite the same after babies. Oh, yeah. We are going there, and we've got the perfect guest for it. Dr. Sara Reardon, a mom, a pelvic floor physical therapist, and the internet's beloved vagina whisperer. She has this incredible way of making awkward topics feel totally normal and giving us the info we wish someone had told us, preferably before that first postpartum sneeze. So we're so excited to chat with her about what's actually normal, what's fixable, and what every mom needs to know. But never hears at that 6-week checkup. Let's dive in with Dr. Sara. Yay!
Hello. Thank you
We
for having me.
thank you for being here. We are so grateful. We have so many questions, so we're just going to get like right on into it. Let's start with your Instagram handle, the Vagina Whisperer. It's bold, it's memorable, and I just want to know how that persona was born and how you feel it helps open up the conversation that might otherwise feel taboo.
I mean, it ultimately is what I do. I am a board certified pelvic floor physical therapist. I've been practicing for almost 19 years, which is pretty wild as a pelvic floor PT. And after about 10 years of practicing, I became pregnant with my own kids and started an Instagram account to share pregnancy and postpartum tips with my group of girlfriends because we were all having babies around the same time in our early 30s. And every summer I would get together with those same group of friends. And when they found out what I did kind of early in my career, they used to call me the vagina whisperer because I would end up talking to their moms, not even them, their moms about like their bladder leaks and their painful sex. And they were like, oh my God, she's like the vagina whisperer. And so it was a nickname they gave me. And when I started my Instagram account, it was for this group of friends. I mean, I think I had 500 followers in the beginning, and I have over 720,000 followers now. And that growth is just a real testament that women are not talking about these issues enough, that medical providers are not addressing these issues. And we need to have open conversations so that women can really get the help they deserve after giving birth.
Ugh, I am so
Amen.
grateful. Yeah, amen. And it's so wild to me that, yeah, we don't. I mean, we have a 6-week checkup and they're kind of like, they push on your stomach a little bit and they're like, okay, see you back in a year for another pap smear.
Right. I mean, you
It's
feel, and
crazy.
it's such a drastic change because during pregnancy, we get such frequent check-ins and checkups, and we feel very kind of nurtured and cared for. And then
Hmm.
you spend sometimes less than 24 hours in the hospital after birth and you're sent home. And there's not a phone call, a check-in, an email, a text message, nothing for 6 weeks. And you literally have gone through one of the biggest physical transformations you may ever go through in your whole life. And so, and you have to keep another human alive.
I know.
And so I just think it's such an unfortunate situation, especially in the US, that we are not integrating pelvic floor care during pregnancy, during birth, during postpartum, not even in the first 6 weeks, but long after to really help moms recover.
Yeah. The biggest question that me and my friends always have is like, is this normal? And it's like when your period returns and you have like blood clots coming out.
Yeah.
And yeah, when you have all that pain and you're like, aren't I supposed to be feeling better now? Like, why am I still in so much pain? And so I'm curious for the moms listening who do have these questions, like, is this normal? First of all, can you explain what exactly the pelvic floor is and what does it do? Like, what is its purpose?
Right. This is a great place to start. So your pelvic floor is a basket of muscles that sit at the bottom of your bony pelvis. So if you imagine that kind of skeleton model you might see in doctor's offices or even on your kids' pajamas, and at the bottom of that is an opening that in our bodies is this hammock of muscles called your pelvic floor. So it's literally the floor of your pelvis. Your uterus, your ovaries, your bladder, your balls all rest inside of that basket of muscles. And this basket of muscles also has the opening for urine to exit the body through the urinary sphincter, the anal sphincter for bowel movements, and then the vaginal opening for vaginal birth and menstruation and vaginal intercourse. So these muscles are also core muscles. So when we talk about our core, we think of our six pack or our six pack muscles a lot, but our pelvic floor is part of that. So these
What?
muscles are supporting your spine, supporting your organs, keeping in pee and poop until we need to empty, They're stretching during pregnancy to support a growing fetus, and they also have to lengthen during a vaginal birth to help baby come down the birth canal. So they're constantly working for us well before pregnancy and birth, but they go through so many changes during those two experiences.
Well,
What?
and then when you have a C-section, so I had two C-sections, are they cutting through those types of muscles?
So no, which is
Okay.
the good news. But when you have a C-section, studies show that your pelvic floor changes just during pregnancy. So it typically gets weaker and lengthened just during pregnancy. So whether you have a C-section or a vaginal birth, your pelvic floor needs therapy after pregnancy. During a C-section, they cut through layers of fascia and skin and connective tissue, and then they kind of separate the abdominal muscles. They don't cut them, and then they go through your uterus. So, but you have layers of tissue that are stitched together and healing, and that can often cause a lot of tightness or restriction, numbness, pain that can overflow into your pelvic floor as well. So women who have a C-section actually have more likelihood to have painful sex, painful periods, painful bowel movements, and incomplete bladder emptying because of all that scar tissue restriction at the abdominal wall.
Wow.
Tracks. This makes
I
a lot
know.
of sense.
No, and that's not to be like, oh my gosh, you're totally screwed. But I want people, women and moms, to be aware that your body deserves care after this major surgery. And there's so many things that therapy and pelvic floor training can do to help your recovery. Whether your C-sections were months ago or years ago, you can still make progress.
I love hearing that. It's music to my ears, truly, because yes, I have a lot of questions, but I know Hallie has a burning one, and then
Oh my
we'll.
gosh. Well, I have a million burning ones. Truly, they're all burning because after my first pregnancy, I have two children. After my first one, I felt like myself 3 months later, physically. Like I was like, great, this is like, I don't know what women are talking about. That's not my journey. And then I got my karma round two because anytime like a wind would blow past me and I would pee my pants. It was like I could not pee my pants. It was crazy. So I did pelvic floor therapy and I think it's really important and I know we're kind of bouncing around, but A, for you, how would you tell a woman that they can know if their pelvic floor is too tight or too weak? And is there like what is that,
Yeah, I
And
actually have a quiz on my website, so I can send you all the link to it, but it's thevaginaWhisperer.com/quiz. And what that quiz does, we go through symptoms that you might be experiencing. So often symptoms that are connected to pelvic floor weakness are going to be like urinary leakage, pelvic organ prolapse, things like that. Pelvic floor tension or kind of being too tight, it's often painful sex, incomplete bladder emptying, straining with bowel movements, tailbone pain, hip pain, back pain, things we don't even think about are pelvic floor issues. Cesarean scar restriction is another one. So when we think of something being too tight or tense, it's not just like your vagina is too tight. It's the whole complex of the pelvic girdle can be tight and overactive. And I would honestly say 50% of the patients I see actually have tension and not weakness, or they have tension. And once we relieve that, then we see the weakness underlying that. So you
wow.
can't just do Kegels and strengthening. It's really important that you get down the right path to start treating your symptoms. And it's not just, all strengthening all the time after giving birth.
See, I did pelvic floor therapy, so I didn't know what to expect going in. And I think it's important that women, I've talked about it on the podcast, but as someone who does this, can you tell our listeners what they could expect if they came in for that first appointment? Because I was like, oh, hello. Didn't expect all that today, but like I might have taken a shower. I don't know. So,
Well, we don't care if you shower. That's the number
yeah,
one thing. We don't give you shower. We don't give you shave. Like, we don't give you wear underwear. Like, it doesn't matter to us at all.
yeah.
And the most common question I get is like, what do I wear? I'm like, whatever you want, because you're going to be undressing from the waist down. So the way we are able to examine the pelvic floor muscles is through an intravaginal pelvic floor muscle assessment. You can also do an intraanal assessment, which we do for folks who don't want a vaginal exam or a male patient, a male bodied patient. But you also can go in and not have an internal exam at all. Typically, in the first session, it's about 45 to 60 minutes one on one with a therapist. And you sit in a private treatment room and you're going to talk to them like, I'm here because I pee when I sneeze after my two babies. But then I'll also ask you questions about like, tell me about your birth history, your menstrual cycles, your what do you do for work and exercise and how's your peeing and pooping? Like I want to get a big picture of pelvic floor health and just overall health. And then I do an external examination, and this can be with your clothes on, where I look at the range of motion of your back, test your hip strength, and maybe look at your abdominal wall if you've had a C-section or any surgeries. And then I step out and I say, okay, undress from the waist down. So bottoms and underwear come off, and you lie down on a comfortable mat with a sheet covering you. We use real sheets. Some people use paper cloths, which I think are really uncomfortable, but we use real sheets. And then I do the internal assessment. And what I do is I kind of look at the vulvar tissue. So this is the labia, the clitoris. I ask you to do a pelvic floor contraction, which is the same thing as a Kegel, and see how you contract and relax. And then I tell you to push or bear down, like you're trying to have a bowel movement or birth a baby. And I see how you can like relax and let go. And then I'll press externally with my finger on the muscles, and then I'll insert a glove lubricated finger into the vaginal canal and do the same thing. Squeeze, relax, push, relax, and I'll press on the side walls of the muscle to see if there's any tightness or tenderness. And that is what helps me, based on your symptoms and that exam, say, is this person weak? Is this person tense? Are they tense and weak? Are they just uncoordinated? And like, what do we need to do to help treat what I'm finding and give them some symptom relief? So don't have to do an internal exam on the first visit or ever, but it does give us more information on how your pelvic floor is functioning.
Also, I have to real quick ask, you mentioned men. Do men have a
Mhm.
pelvic floor?
Yes, everyone has a pelvic floor. Kids, trans, men, everyone. Men just have two
What?
openings, where like for the urethra through the penis and then the anal
Right.
opening. But we see men, I see a ton of men you wouldn't know I'm the vagina whisperer, but a lot of urinary leakage, prostate issues, pooping problems,
Oh,
sexual dysfunction like erectile dysfunction and penile pain, testicular pain.
Wow.
I mean,
had
all
no
kinds of
idea.
pelvic floor issues. Yeah.
Also never talked about.
Yeah.
Also never talked about.
Wow.
And
Interesting.
and they don't go through these, experiences like birth and
Right.
pregnancy or menopause where our bodies are going through major shifts. With them, it tends to be like if they have a prostate surgery or condition, or I mean, even men who are super stressed out and sitting a lot, or they ride bicycles, or they ride motorbikes, or like things where there may be compression or tension, or there's a plethora of issues they can experience. But if it's peeing, pooping, or sex or pain, it's usually the pelvic floor is involved.
Interesting.
Fascinating.
Mind blown.
Yeah. I
And a lot of our patients also are like, oh, I think my husband could have a pelvic floor problem. And they come in and we treat them as well.
Oh, a,
Incredible.
a
Yeah.
date. Make it a date.
Yeah, double date.
No,
Coffee
it
and
happened.
pelvic floor. Yeah.
But okay. Everyone that I know that has had a C-section feels like their skin or like their stomach muscles never quite like look like they did. Like there's a little bit of like stretched out skin or there's a little bit of like a shelf. And I'm wondering, is that related to the pelvic floor? And does that ever go away without surgery? Like a tummy tuck or a quote mommy
Totally.
makeover?
This is a great question. I think it's really common because it's also what we see externally is just like 10% of actually what's going on internally. And because your core and your pelvic floor are so connected, that there is a relationship between those. And I say that because this is something that we do treat. When you have a scar, and a scar is healing, you get maybe like less than 50% of the same mobility of that tissue as you did pre-surgery. So that tissue just gets kind of stuck. And what happens is when that tissue gets stuck, all of the additional skin or even, fat or anything like that kind of hangs over that stuck scar. And that's what we call a cesarean scar shelf. Now, one of the things you could start doing is a lot of scar massage. So, we start this as early as 4 to 6 weeks after giving birth, but again, you can start it at any time. We do cupping around the scar, we do dry needling around the scar, we do a lot of massage to the scar to get those tissues moving. However, if it's to a point where you don't have pain, you're peeing and pooping well, and sex feels fine, but the scar cosmetically and your abs cosmetically don't look the way that you want them to, then I typically do recommend going on to work with a plastic surgeon, which is totally fine. I mean, you want to feel good in your body. And so sometimes just removing some of that scar tissue and kind of taking some of that excess tissue out is what cosmetically will help it. But I've also had a patient who had a C-section and she was starting to work out so much more intensely and she got a worse DRA and she started getting hip pain and her scar was fine, but other issues kind of arose around it. And she ended up getting her diastasis repaired and a tummy tuck and still came to therapy before and after to see me. And she's doing amazing. And so sometimes it is more than just cosmetics. It's like back pain or hip pain that she didn't even know was attributed to her C-section. But
Right.
the shelf is common. There's some things we can do for it. It's never too late. I've worked with women in their 60s and 70s on their abdominal scar, but typically if it's pretty tight and restricted, there's only so much we can do. And then I would say it's just the cosmetic change if you'd like it.
Right, right. I saw this video on your Instagram, and I think it was like one of your most watched, and it was actually about doing crunches. Speaking of abs, that crunches are one of like the least helpful ab exercises
Totally.
you can do. That's true?
Yeah, because you have four different layers of abs, and all we talk about are the six pack abs, but you have these deep transverse muscles, which are like your super deep core muscles that support your back, engage with your pelvic floor, give you that like flat, zipped up tummy look. And then you've got your obliques on the side, internal and external, and then you've got your rectus six pack muscles. Crunches work your six pack muscles, but you've got all of these other deep core muscles that you really need to engage to get not just like core and pelvic floor support, but like that snatched waist that we all want where everything looks kind of slim and tucked in. And so we really do a disservice by just doing crunches all day. You can do crunches with bicycles, like bicycle kicks. You can do planks, side planks. I mean, there's so many other things you do. And I have an app called the V-Hive and it works a lot on pelvic floor and core because you could be doing all of these core exercises, but if you're not even engaging your pelvic floor, then you're missing a huge piece of engaging your pelvic floor, getting those deep transverse muscles turned on, and you're just not working the muscles that are going to give you the results that you want, both physically and functionally.
Um, this is changing my life. I do a lot of Pilates. I probably go like 4 times a week. And I feel like that's helped so much in like building my core. But yeah, we never just sit there and do crunches. Like you're doing full on like bicycles, you're using the machine, you're doing like
Which is
planks
great.
like crazy. And I do feel like it's helping. Um, just since we're on this topic though, scar tissue, does it ever go away on its own?
No. You can, if you let it sit, it will be there. But if you massage it, mobilize it, do therapy on it, yeah, it can totally get better. But
Okay.
there's just sometimes like, there's only so much you can do because you have had surgery. But I mean, I have people who have beautiful scars and they move well. And I have people who have beautiful scars, but they're also like stuck to their abdominal tissue underneath and they have some pelvic floor and core issues. So I always tell people like you have to work on it to see where you can get. Even if you had a tummy tuck, like you need to go see a therapist and work on or watch my videos on how to do scar massage to mobilize that scar tissue. You have to, 100%.
I will be watching as soon as we are
Okay.
done with this Zoom.
I love so much that you have your branding is amazing, by the way. V-Hive is like giving
So
me,
good.
it's like Beyonce, like the Beehive, but V-Hive. And also,
Totally. And that's
uh,
like how we came up with it years ago. We were just like, we need a name for the vagina whisperer community. And some of this is just the thoughts in my head. It's not like I
so
have this
good.
huge marketing agency behind me. I'm like in the show, I'm like, this would be funny and this would be fun.
You
So
could side
So
hustle
good.
and do that. Or like if one day you decide to switch careers, you could do it. Because also on your website, you have this great picture of you in a vagina costume. And I was like, where can I get that? I need that. It's too good. Like I need that for something. I don't know what, but it's amazing. I
It is
love the
good.
whole way you approach this is so digestible and amazing. I do want to go back a little bit just for anyone who's listening who might be pregnant and be thinking about this. How soon after giving birth can you safely start doing pelvic floor therapy? And then on the other side of that, is it ever too late?
So I'll answer the second part first. It's never too late. I mean, again, I have patients in their 70s, 80s, even 90s coming into pelvic floor therapy now. As we age and after menopause, which most of us hit, the average age of menopause is 51, but I'm 43 and I'm in perimenopause now. You lose 2% of your pelvic floor strength every year after menopause. So you have to be actively working on it or else you will most of us will end up with incontinence, urinary leakage, fecal leakage, things like that. So, or prolapse. So this is a lifelong thing. I always say it's like brushing and flossing your teeth. You can't just like get a cavity fixed and then be like, oh, I don't need to brush my teeth anymore. Like this is something that we have to integrate into our lives. And why I'm so passionate about being vocal about it, because we're not telling women this, and then they're ending up in diapers. So it's never too late. The other piece is that during pregnancy, what I really encourage women, if anyone's pregnant, listening to them, to start working and doing pelvic floor training during pregnancy.
Mm.
And the research is very clear that women who work on pelvic floor training during pregnancy will have less back pain, less leakage, better births, better postpartum recovery, because we're training the muscles that are going through a dramatic change and then kind of helping you prep for postpartum recovery. Now, I have a whole pregnancy and postpartum recovery program, and the postpartum recovery program starts on week 1 after birth, but it's not like major exercise. It's like diaphragmatic breathing, going for walks, like little bits of like deep core contractions and pelvic floor contractions that you do while you're pumping or breastfeeding or rocking a baby. It's really small things that you can start integrating into things you're already doing in that early postpartum period. But then around 4 to 6 weeks, you do start building in like glute strength and core strength and pelvic floor contractions. And it's not just like sitting in your chair. It's like standing, walking, lunging, lifting. Like you need to be able to lift a stroller, lift a baby carrier, get off of the ground without falling over, go up and down stairs carrying a baby. Like we need to train your body to be a mom, and also not just to get back to exercise, but to literally live your day-to-day life. And so that's what I think is really important, where moms need that support. It's not getting back to like Orange Theory or your Peloton. It's like, how can I actually be a mom without leaking or pain?
Right.
Yeah.
You mentioned perimenopause. I'm 40, Hallie is 41, and we feel like this topic comes up all the time. You said you're 43 in
Yeah.
perimenopause right now. What were your first symptoms, and what are things that we should be looking out for or asking our doctors to even test hormonally?
So, unfortunately, in the US, it is like pulling teeth getting a physician to actually listen to you and order lab testing for perimenopause. But if you do have a medical provider who will do hormone testing, a lot of them don't, because they're like, it's not the gold standard. I'm a data nerd. So I'm like, I want to see what this looks like before. I want to see what this looks like after. It's usually day 3 of your menstrual cycle, day 2 or 3, you go in and you can get your estrogen, your progesterone. There's different types of estrogen that you can look for. Your testosterone, your free testosterone. I also say get your thyroid checked, get your iron levels checked, like kind of a whole panel, but specifically a hormone panel as well. And what happens during perimenopause is some of global symptoms are like, we always talk about like dry skin, dry eyes, your hair is going to start falling out. You start getting like mom rage more often. You are forgetful. You get tired. Pelvic floor wise, you start having more vaginal dryness. You need more lubricant during sex. Sometimes it can feel itchy or irritating. You start peeing more often. So maybe you wake up once or twice at night when you never used to, or peeing several times before bed. More urinary leaks, like when you run or cough or sneeze, you start leaking. And also heavy periods. Because when you have a heavy period, like we all know that like crime scene situation, if you're not on an IUD or birth control, where you're like, this is like a murder scene.
Well, like the
Somebody came in
clots
my
are like
bathroom. It's heavy.
Literally, yes.
And it's because your progesterone levels are low, and that progesterone level right before your period dips down so low that you get these really heavy clots, you get headaches. I get like mom rage, like I'm like the meanest woman ever for 2 or 3 days to my
oh
family.
God,
And
same. Mostly to my
same. And
husband. I'm like,
yes.
I need you out of my way.
Yeah.
One day we were going for a walk, my husband and I, and he was agreeing with something that I said. And I was like, what do you know? And he was like, oh, God, I was agreeing with you. And he was like, I'm agreeing with you wrong now. And I'm like, I'm so sorry. This is like, I'm starting my period tomorrow. But it's
So
a real
relatable.
thing.
Yeah.
I'm sending this episode to my husband to
Yeah.
listen so he knows it's not just me.
Yeah.
It is
Clip
a
it.
Right. No,
Yep.
it's many of us.
Mhm.
But one of the things that I really encourage is starting small. You don't have to get on all of these patches, but a lot of us think that we're low estrogen, and we may be low estrogen in the vulva and vagina. So that is a good place to start. So using a topical vaginal estrogen cream It doesn't go to your whole system. It stays very locally, but can help those pelvic floor tissues get stronger, help with leakage, frequency, urinary tract infections, vaginal dryness. I recommend using a vulvar balm or vulvar moisturizer. So this is like a balm. My favorite one is by this brand called Medicine Mama, and it's organic and hormone free. And you just put it on after the shower, but it helps like moisturize the vulva and vagina and make those tissues less dry. Think about all we do for the skincare on our face.
Right.
Like we need to have that for our vulva as well. You need to stay super hydrated and you need to strengthen your pelvic floor. You have to, because these muscles are decreasing in strength. And we talk about how we need to lift weights and do strengthening for our whole body, but you have to do that for your pelvic floor. These are skeletal muscles that lose strength over time. So getting a strengthening regimen is essential.
I desperately want to talk about sex. I always want to talk about sex, but especially with you because I was always told you want to have a tight vagina. And so do your Kegels. I'm curious, when you have a baby, I've asked my husband, I was like, does it feel like, a huge hallway now? And you're just like this empty void that you're like swimming. And he's like, no.
Sliding down.
Yeah. He's like, not at all. And I don't know if he's lying to me, but what role does the pelvic floor play in sex? And is it different after having a baby?
So your pelvic floor kind of makes up your vaginal canal. So your vaginal canal, think of it like a sleeping bag, right? And so it's got kind of all these walls and they're typically kind of can be more like collapsed. But then when something goes in them, they can open up. But those walls are muscular. So when you insert a finger or anything into the vaginal opening and you do a pelvic floor contraction, you can feel a squeeze around that finger, and that's your pelvic floor muscles. So yes,
Is
your
that why
pelvic
your
floor.
husband or your partner likes it when you do like a little
Tighten?
Kegel when they're inside you?
Yeah, because it gives them
Yes.
more, think of it like a tighter wrap around, when you're in a sleeping bag and you like pull the blanket really tight, it's like that's a tighter, like cozier fit, right?
You're giving his penis a
So
hug.
you're giving his penis a hug or a dildo or whatever it is you
Yeah.
want to put in your vagina. But so, and the role of pelvic floor muscles during sex as well is that blood rushes to the pelvic floor muscles. There's two layers. There's an outside layer and a deeper layer. The deeper layer is kind of that sleeping bag that hugs you. The outer layer are actually the ones that help with clitoral engorgement and orgasm. And so when
Mm.
you've got muscles externally that are relaxed, because a lot of people can't have orgasms because their muscles are not too weak, but they're too tight and they're not getting enough blood flow to them to kind of help get to that climactic area.
Wow.
So blood flows to the area, we get engorgement. The majority of people have an orgasm with clitoral stimulation, not vaginal stimulation. Like 90% of women have clitoral orgasms. And so when you have a clitoral orgasm, those pelvic floor muscles externally contract and relax. And then internally, if you have stronger pelvic floor muscles, it is like a tighter wrap. So there is more sensation in the area. What happens postpartum is that these muscles weaken over time during pregnancy. They're getting stretched out, they're lengthened. I always say, think of, during pregnancy, we get these text messages or emails that say, your baby's the size of an avocado, then it's the size of a papaya, now it's the size of a pumpkin. Well, imagine a hammock holding a papaya is going to be very different than a hammock holding a pumpkin. That hammock is going to be stretched out and lengthened. And that's what happens to your pelvic floor during pregnancy. And then if you have a vaginal birth, it can be a little bit more lengthened. If you have a C-section or a perineal tear that is sutured, that can cause some restriction. So the pelvic floor can get weaker, but also you may have scar tissue either from a C-section or at the opening of the vagina that can cause some pain and restriction. And 9 out of 10 women, the first time they have sex after giving birth, it's painful. It can be due to dryness, but it can also be due to tense pelvic floor muscles or scar tissue. So you want to, again, this is an area where you don't just want to tighten and do Kegels all day. You may need to do some relaxation work to the pelvic floor, which again, I have an entire program for working on scar tissue and breathing and yoga, and then do strengthening to help get more toned pelvic floor muscles and stronger orgasms.
You mentioned that the majority, I think 90% you said of women, they orgasm through the clitoris and not
Yeah.
necessarily like internally.
Turtle. Yeah.
So do all vaginas A like feel the same inside, and B, what's like a tip for the men right now in how to make your lady orgasm through the through the clitoris
Or through the
So I,
vagina.
or
or
through
through
the
the vagina.
vagina.
So I think one thing is when we understand how the body works, we can find ways to help us achieve what we want to do, right? So if you want to have orgasms, I'm like, you kind of need to practice on your own before bringing a partner in so that you can understand what feels good to you. Like some people want internal stimulation and external stimulation. Some people just want a clitoral orgasm with a vibrator. Some people need oral stimulation. So there is this piece of you have to experiment a little bit because no bodies are the same. And sex is not just like penis in vagina or,
Yeah.
dildo in vagina or vibrator on clit. There's so much kind of psychologically, emotionally that goes into it, and not just physically and mechanically. So I always say there's things that put your foot on the brake and make you not want to have sex and not kind of reach climax. And there's things that put your foot on the gas. And putting your foot on the gas may be using a vibrator or using a dildo or having, a lubricant or whatever it is with your partner. But things that put your foot on the gas are like stress, my running to-do list, being tired, having a kid in my bed, not being connected with my partner. So it's all of these things that are not just pelvic floor related. But I tell people to practice. I tell people you have to communicate with your partner so you can tell them what feels good. Don't be afraid to use a vibrator externally or internally to make magic happen. And I think your partner, whether it's a male or a female trying to have you orgasm, needs to also understand that orgasms happen differently for different people. And it takes a lot of time. And it's not saying that someone can't orgasm because something's wrong with their partner. It's just there's a lot of factors. And if partners, in particular men, know that like the majority of orgasms happen externally on the clitoris, then you may want to spend less time internally trying to make it happen, or a
Right.
combination of
Yeah.
both.
A little more foreplay.
So do women come to you who have a hard time orgasming and do pelvic floor therapy for that? Like
Yeah, they
internal?
do.
That's interesting.
A
I didn't
hard
know
time
that.
orgasming or the inability to orgasm. Yes.
Interesting. And so does a lot of that work with stretching the pelvic floor? You said that usually happens when it's too tense. So is that more stretching internally?
It could be releasing some external tension around the muscles externally, internally as well. Also kind of helping them use different devices. So there are some people who can't insert anything into the vagina because their muscles tighten up in response to that.
Mhm.
So teaching them how to insert something, maybe they need more like G-spot stimulation, or a combination of both. So it's yes. I mean,
Yeah.
but I also, again, orgasms are connected to blood
Right.
flow and nerve function and pelvic floor function and social emotional health. So I stay in the lane of what my piece is, but
Hmm.
it does help them understand that this isn't just in your head and it's not just concentrating, or there's actually a physical thing that you can work on that can be helpful for you. And we don't talk about these things.
No.
Like who do you talk to? You don't talk to your gynecologist. You may be too embarrassed to talk to a partner or even a friend. So we're like the walls of secrecy where I'm like, there's no such thing as TMI. If I don't have the answer, I'm going to help you find it from someone else if it's not me. And what you're experiencing, many women experiences, you're not alone.
Mm. If all medical professionals were like that, this would be a
Yeah,
much better place for women. Let me just say, thank you for doing your part because that's
truly. And
great.
I hope every single woman on this planet listens to this and
I
can like
know.
take something
Me
away because
too.
it's been so informative. And I know that we are just about out of time. But since we are talking about vaginas really fast and red light therapy is such a hot trend right now, red light therapy, underwear on your vagina, yes or no?
So I don't know the research on the underwear, but there are studies that there is an internal wand by a company called Fringe, and they use an internal wand to go into the vagina. And they have some women using this for postpartum healing, postpartum scar tissue, pelvic for urinary incontinence. So there is a study that has been used on this device and specifically this device specifically, like an internal wand that has been shown beneficial. The tricky part about red light therapy is once you stop using it, you no longer get the benefits. So you can either use it consistently or inevitably, but you still have to do your pelvic floor training. You still have to use your topical estrogen. You still have to use your vulvar balm. You may still have to use a lubricant, but you've got to use, it's the same thing. Like we can use like a teeth whitener and it's awesome, but when you stop using it and you go back to your old ways, like it's not effective anymore. So I think it's a great thing because it can really help boost collagen production and blood flow to the area, but it's in conjunction. It's kind of part of the puzzle versus like solving the whole problem.
Okay,
Yeah.
got it.
And the reason
Wow.
that the internal wand is better than the external underwear is because that external underwear only penetrates so deeply with red light therapy. If you really want to get into the pelvic floor and the vaginal tissues, you have to go internally in the vagina.
Mm.
You are a wealth of
Yeah,
knowledge.
you
Like
are.
truly, and I just want to say if you guys want more information, you need to go follow the Vagina Whisperer on Instagram because
It's
there
a
are
good
so many,
follow.
it's like such a good follow. And also,
Thank you.
like one of my favorite videos of yours is like you're not supposed to push when you pee. What? Like that
Yeah,
is what
that
people,
one,
yes.
it went viral, 43 million views. And I was like, wait, 43 million people don't know you shouldn't push when you pee?
I
Y'all, we
didn't
have work
know.
to do. I know.
So
We
you
have work
should
to do.
not push when you pee. You should just kind of like let it, you should sit and
Sit,
let it just,
chill, breathe. Yeah.
Interesting. What about poo?
Yeah.
Is that
Poop, you can poop, you can push to poop,
okay?
but you should have a step stool under your feet. I might the squatty potty
Love a
or
squatty
and your
potty.
kid's toddler stool
Mhm.
because that helps put you in a squatting position which relaxes your pelvic floor. You can push during pooping, but you shouldn't hold your breath. I tell everybody to exhale like they're blowing out a bunch of candles. Or I get those little twirly straws that my kids get from birthday parties, and I put that in the bathroom, and you can blow through that. And that is like how you should be blowing out when you bear down to poop. But during peeing, you just sit and chill, pooping, feet up, blow out, and bear down.
wow.
Interesting.
You're good to go.
Yeah.
What if you want to make sure you're emptying your bladder like fully? You still don't push when you pee?
You do not push when you pee. So what I do is I recommend that people do what's called double voiding. So you sit, chill, and breathe. Breathing helps relax your pelvic floor muscles so that your bladder can contract to push the urine out. So you don't have to push. And I say wipe, kind of wiggle your hips, stand up, and then sit down again. And that's
Mm.
called double voiding. And you will get out like any last residual drops without pushing. Pushing weakens your pelvic floor over time and actually causes incomplete bladder emptying.
Wow.
So, and then you just wipe and walk away. And there's always a little bit of urine left in your bladder. That's normal. There's a residual volume that can be a couple tablespoons. So you could like sit and push pee out all day, but your kidneys are constantly making urine. So you'll always have urine in there. So try a double void instead of pushing.
Wow.
Wow.
You learn something new every day.
This has changed my
I
life.
know. I, we are running out of time. We've been so generous with your time. It's the holidays. We want to let you go. But for moms who are listening who just feel like, oh, I just don't have time, we are learning this is now not just a post-baby thing. This is lifelong maintenance. What is something you could, a little digestible thing we could do every day for our pelvic floor in between grocery runs, car pickup,
Yeah.
car pools, etc. What could we be doing?
Mhm.
I am also a mom of two
Yeah.
and working. And so I totally get, and some of the things that we discussed on there are just like the basics of don't push when you pee, only pee when you have the urge, don't go just in case. Pooping, don't delay the urge. Like make sure that you're emptying well with your feet up. But I also think about it's little things that you're likely already doing that you can pull this pelvic floor contraction and deep core engagement into things you're doing. So I have a whole app called the Beehive app, as I mentioned, and it teaches you just how to engage these deep muscles. And then you can bring it into workouts. Like you can bring it into your strength training workout, your Pilates workout. I just did yoga this morning and I was like drawing my pelvic floor in as I'm holding a pose. So it's not something extra that you have to always add on forever. If you take a little bit of time to carve out now, I mean, and my workouts are like 5 to 10 minutes. Like I'm a mom. I don't have
Mhm.
45 minutes to carve out every day to do this.
Yeah.
But you get these little nuggets of information that eventually you're like, oh, I'm going to engage my pelvic floor and exhale while I'm lifting the stroller or the baby carrier or the laundry or the weights at the gym. So you find ways, once you get the knowledge and training, you build it into your day-to-day activities and workouts, and then it gives you lifelong benefits.
Oh,
I cannot
I'm
wait
gonna
to
do it.
start. Yeah.
I know.
Tonight I'm going to massage the scar before
Massage the
bed.
scar.
Yes.
Can we be the presidents and vice president of the Beehive?
Sure.
Great.
Of the
Like,
fan
Self-appointed.
club.
Yes.
Yes.
I love this. I call
Oh,
myself the chief vagina officer, so the president and vice president roles are available.
Again, the branding is
it's
chef's
so
kiss.
good.
It's so good.
You are wonderful. Thank
Yeah,
you for giving us time. I think we are going to have to do a part two.
have to.
Happy to.
Yes, you guys follow her. Please follow her. Go to her app, download the app. She is um changing lives.
Yeah.
Truly.
So, well,
You're
thank you all so much for having me. And for, I mentioned the app, it's 7 days free for anyone who wants to try it out because people are like, what is a pelvic floor workout? So I just want you to get an understanding of what's going on with our bodies because we're just not told. And so I really just hope it helps women feel like they understand what's going on. They can be proactive about changes or get support if they're already experiencing pelvic floor issues. So, yeah, I just hope that you all love it. And thank you so much for having me on to talk with your community.
you're a dream. Thanks for hanging out with us on Between Us Moms.
Don't forget to follow us for more mom life conversations and content, and subscribe to our newsletter so you don't miss a thing.
And if you liked this episode, send it to a mom friend.
You know, she'll get it too.
See you next time.